know more about the different butt augmentation procedures. Can you tell me about it?
Yes. There is something important that you have to know. We have three options for this treatment. Okay? First option is about fat grafting or fat transfer. We harvest your fat and then we wash, we prepare the fat and then we inject in the butt area. Okay? This is number one technique. Okay? The second one, in this first one, is related with the liposuction.
Okay.
Is the way that you're gonna harvest the fat.
Okay, so liposuction first, take the fat and then transfer.
Yes,
okay.
But in the same procedure.
Okay, at the same time.
Yes, this is one option. So the second option is fillers injection. Okay, we have one kind of hyaluronic acid.
Okay.
That's the only kind of filler that can be injected.
Okay.
Okay, there are liquid silicone, there are other fillers that they are not hyaluronic acid. This is very bad.
They will cause problems in the future.
Yes, yes, but hyaluronic acid, there is no problem. Okay, this is the second option. And the third one is silicone implant.
Doctor, for me, because I feel like I'm very small, I'm very petite, and I feel that of course I don't have any fat, so that is not an option for me. And for fillers, I feel they will help, but I feel like they will not give me the projection that I want. So can you explain to me a little bit more about the butt implants procedure?
Yes. In our case, you have to know something. Let's say you're gonna do the fillers injection. Okay. Fillers injection is quite highly costly, okay, first thing, and doesn't last more than 1 year. Some patients maximum 1 year and a half, and then you have to inject again, okay? But about the silicone implant is something amazing. The implant is located between the muscles. Before, the technique was above the muscle, and then we had some problems, okay? But now, because we have three muscles in the butt area, now we put between them. The implant is totally covered by the muscle.
So you cannot even see it or know that it's there?
No, you cannot see it, you cannot feel it. It's very great result.
And can you tell me, doctor, about the sizes, the different implant sizes?
Yes, see, usually I like this kind of implant because it gives center projection. Okay. As you can see, the implant is round, okay, and we have in the center the highest projection point, okay. When you put in the butt, it looks like this.
So very natural.
Yes, yes. And I don't recommend, like, we have to see what you want, but you have to consider your bone structure, your size, and the result you want, okay. But usually we don't start with big size because it can be over, okay, and doesn't look like nice. You know?
So according to the body type, the implant sizes are picked.
Yes.
Okay. Tell me, doctor, about the surgery. How long is the procedure, and is it under general anesthesia?
Yes. Usually we have one small incision between the gluteus. Okay. Before it was through here. Okay. Now it's between the upper area. The scar doesn't show. It's amazing.
It's amazing, yes.
The scar is very small. It's around 4.5 centimeters. We open and then we go inside the muscles. Okay. The procedure spends around one hour. I do recommend you stay in the hospital for 1 night because it's quite painful. And of course you're going to be under strong medication, painkillers I mean, but if you stay in the hospital for 1 night, it's perfect.
Tell me, doctor, about the recovery, because I hear so many different things. Some people say you cannot sit for 2 weeks, some people say for 3 weeks, some people say for 1 week. What is the recovery like? Okay,
yeah, you must be ready to don't sit for between 1 week to 10 days. Okay, no driving, no sitting, you're gonna be standing, okay, laying down your back or laterally.
Okay.
Okay, you can lay down laterally, but don't sitting. Okay. This is the toughest time in the recovery, but just for 1 week. You must prepare for it. It's a good option, like if you take off of our work, okay, and be ready to do it.
What about the lymphatic drainage? Does that help with the recovery?
It helps a lot. It helps a lot, and it's very important, okay, because you can have like local swelling around your thighs also. They can be swelling, but with the lymphatic drainage, it's amazing. It helps a lot to recover the surgery result. That's why I even don't put drain.
Okay.
I don't put the tubes to bring out, because when you start doing the lymphatic drainage quick, we have an amazing result.
So it helps a lot with the healing process.
It's very important. It helps a lot.
And then after recovery, doctor, do the implants feel natural?
Yes. After the recovery, okay, let's say for the first month, it looks a little bit like it shows a little bit, but according to the muscle we adjust it to the implants, okay, it looks very natural.
Okay, and when can the patient resume normal activities like sports and swimming and things like that?
I believe like around 2 months, she'll have her exercise life totally back. There is no restriction. Even riding horse, there is no problem. I have patients riding horses, swimming, running, doing everything they need 2 months after the surgery.
Okay, thank you so much, doctor.
Welcome, dear. Thank you for coming.
Thank you so much, doctor, for your time.